All right, I think we are ready to get started. Well, thank you everyone again for joining us. We are excited to share with you our new Archibus Healthcare package. Before we get started, I do have a few housekeeping items. First one, everyone is on mute, so if you have any questions, please feel free to enter them into the chat or question section, and we will get to those at the end of the presentation. We are recording this session, and we will send out the link probably tomorrow, so to everyone that has attended or registered. So with that, I will turn it over to Fred Kraus.
Thanks, Danielle. And I trust you hear me okay?
Yes, we can.
All right. Hi, everyone. Thanks for coming and listening to us and talking about what we're doing with healthcare. I'm also joined, I'm Fred Kraus. I'm in the product team over at Archibus, and I'm joined here by another colleague on the product team, Octavian Vlad, who's been working very closely with developing this healthcare solution. So with the Q&A time, he might help me answer some questions, and he definitely helped put together this slide deck. So thanks to Octavian as well for his help. So today, we're going to talk about what we're doing to make product improvements that really are focused on the healthcare industry, and taking you through our thinking and what we've learned and what we plan to address with that focus. I'll start by kind of overviewing what we feel the need is and who the primary roles are, what they care about. You probably know better than we do, but this is what we've heard. And then I'll talk a little bit more in depth about the solution. I'll end with a brief video demonstration of what we put together so far and what's next before we wrap up with Q&A. Whole thing should probably be about a half hour, maybe a little bit longer. So healthcare, themes that we continue to talk about related to healthcare, and these words are on the screen, but I'll just make a special note of them because they'll keep on coming up. Enabling effective patient care, and how in a facilities or compliance role, how do they connect to that picture of enabling effective patient care, which is really, obviously the main mission of any healthcare facility. Optimizing maintenance operations, with patients always needing to be seen and needing services. How do the operations around maintenance affect that picture, and how can that be optimized so that we get patients into rooms where they need to be to again affect good patient care. Complying with country, city or local regulations to reduce risk. That comes up a lot in healthcare. Obviously, if healthcare facilities are not compliant with regulations, then there are serious repercussions and fines and other issues. And tracking and making the best use of space. Back to, it really kind of ties into the maintenance operations picture, but also about how is space tracked, how is it categorized, and how does that meet the compliance needs of the healthcare organization. So all of these are the key themes that I'll talk about as we proceed in the presentation today. So, and I believe I covered these points as I mentioned those themes in this slide. So what we've heard are really focused around two key roles: the facility manager and the compliance manager. And one of the things that strikes me about what we've heard is about balance, the careful balance that these roles have to play in managing the healthcare facility. The facility manager needs to balance critical maintenance activities with access to space. I kind of mentioned that before. There's Also, obviously, continual and unpredictable wear and tear of space and critical assets as patients flow through the facility. And how does that facility manager balance making sure that those maintenance activities are taken care of with the access to space that's needed? And of course, responding to inspection-related questions is always what we've heard is on the facility manager mind. The compliance manager also must balance, the hard work of overseeing remediation of deficiencies with maintaining compliance and proactively maintaining compliance and important accreditations. So that's also a careful balance that the compliance manager needs to strike, making sure the spaces are compliant. So we'll talk about how that happens with tracking specific space attributes that the healthcare facility needs to track. I mentioned resolving facility deficiencies and making sure that those important accreditations are maintained proactively. So rolling that up, the healthcare package is that integrated facilities platform that we're putting together, bringing space, assets, and maintenance together to put that picture together that the facility manager, the compliance manager needs to see to ensure operational effectiveness and proactive compliance, proactive regulation compliance. Tracking important healthcare specific space attributes, supporting inspections and reporting, and of course, deficiency management. I mentioned here the National Fire Protection Association and Joint Commission among others that that are key. And when they come into the facility, they mean business, and the ability for the facility manager or the compliance manager to show that that these spaces are being tracked appropriately or being compliant, that remediation is being handled, is of course very key to success and to reduce risk of any non-compliance. So we talk about bringing those kind of key attributes together in one place and really broaden what Archibus can do to track those specific attributes around the healthcare facility. What's in it for you? So we, this is, I think, the last slide in the overview, but really talking about how these things affect both savings and increased revenues. So the first two really are about saving on operational costs and on compliance by being able to comply with regulations and improving that operational efficiency I mentioned before. On the revenue side, we talk about offering that, I go back to offering an effective or excellent patient care. Being better stewards of the facility enables that to happen, and certainly, tied to that is increasing the revenue by optimizing the space resources, making sure that the facility is making the best use of space. Someone mentioned, maybe on the call, I'm not sure, but someone mentioned heads in beds as a key metric, somewhat of a term that is more probably in play, but it really makes sense that that's really what's very important for the hospital to keep running effectively. And of course, I mentioned here with hospitals really across the world running at near full or even over capacity for the past year because of the pandemic, all of these factors are just even more important. They shine a light on the facility, and being able to run an effective facility in this kind of atmosphere is just even more critical. So that's what we've seen by collaborating with many of you and with our partners and understanding the facility market, the healthcare facility market, I should say. And I'll go in now to more of a deeper dive into the product. So taking all of that into account, we're building Archibus Healthcare around that to enable both, getting all that information in one place, and through homepage with dashboard that really gets those key metrics that front and center, and I'll talk about those metrics in a bit. Shortcut to key tasks and reports, so when you log in, you get all of that information up front. And the facilities console, which I'll talk about more, that really is meant to track and report on those space and regulatory attributes, and being able to visually explore the floor plan, and highlighting those attributes that the facility manager really cares about. Specific healthcare information, bringing together that maintenance work, so that you can see that in the context of the floor where that maintenance is happening, checklists and follow-up actions, compliance requirements, and assets, locations, and that includes also fire assets as well. All of that is made possible by leveraging what we've done in the past year in user-defined fields right out of the box. So if you don't know that, Archibus in the last couple of releases has enabled really making it easier to create fields that are needed, and we leverage that infrastructure to help us really hone in on that key criteria that the healthcare facility needs. So we are building the healthcare version 1 on Archibus version 25.4, which is the latest release. And as I mentioned, it brings together and includes space, maintenance, our performance metrics framework, and healthcare specific functionality around the facilities console, which is an added benefit that we're specifically working on in addition to the package of the standard space maintenance, and of course optionally compliance if there's a need to manage more holistically a regulatory compliance program. A lot of that in terms of maintenance checklists to be able to comply is in maintenance, but the holistic regulatory regime is in compliance. So there's kind of two levels of being able to respond to regulations. Just a look at the homepage, what we're working on, and again, this is still in development, but these are things we're actively looking to get feedback on now. But as I mentioned, the driver here is to be able to see important metrics right up front, and being able to navigate from here to where you want to go quickly and easily. So some metrics we're looking at around maintenance, open and overdue requests, work completion percentage, count of deficiencies, and then of course other items such as licensed beds and room access availability. And then, as I mentioned, from there going right into consoles that are front and center in this world, like the space console, the maintenance console, and the new facilities console. So on to the facilities console. I have a few. I think the rest of it will hone in on that a little bit more, because this is where we're bringing together, as I mentioned, the key information from various disciplines across Archibus. One is the ability to track and search on healthcare space attributes, and there are many of them. And the list is here. I'll show it in a video later as well. But anywhere from the NFPA occupancy types to room flags to licensed bed counts, hazardous material, all of those things being able to track and visualizing the floor plan and reviewing open maintenance work related to just maintenance or related to compliance and deficiencies. Highlighting on the floor plan, of course, any of those attributes that we want to be able to highlight, so to make that to allow for that visual, those visual cues and the visual report. Room attributes like pressure, room pressure, which is very important, NFPA occupancy types, any pending work requests, whether they're PMs or on-demand work, and checklists and deficiencies. Being able to display fire and safety assets, I mentioned that before. Being able to relocate by dragging and dropping those assets. And of course, switching quickly between highlights to see different views of your facility and different floors is also critically important. An example of room pressure is so this is something that the Joint Commission, I'm sure you know, asks about. Show me where your positive and negative pressure rooms are. Show me that you're complying with that and being able to report on it. And here you can bring that up very quickly on the facility console. Positive pressure rooms for areas like your surgical rooms, your operating rooms, and negative pressure typically for waiting rooms, things like that. So being able to report on that, we've heard is very, very important. Being able to search for or see where rooms are accessible and any work pending to plan and optimize your maintenance work. So here's an example of showing which rooms are unoccupied and where the work is and what the priority of that work is. And again, from the facilities console, being able to bring up that information up front and dive into some of the details and individual work requests is something we're bringing together from, again, different disciplines, different modules in Archibus, and bringing it into one place to really help you do your work effectively. And bringing that together, I'll happy to share this brief demo. A first look at what we're still working on in the facilities console. So here's an example of a hospital floor, and all the highlights you see here are really related to what I mentioned, healthcare specific fields that we can now report on very easily in one place. Here's an example of room pressure types, bringing up the ones that are negative, neutral, positive pressure. The ability to track and report on this is one thing. The ability also to just easily corresponding information, to see the corresponding information on the left-hand side. You can the user can edit any of these attributes, even the names of it, the color that you see on the floor plan. So all of that is configurable because obviously it needs to apply to your specific situation. Other example, fire protection. So obviously for compliance reasons, most rooms have to be have some level of sprinkler capacity, and this is just an easy way to report on where that is and what level of capacity, what level of sprinkler there is. Occupancy types from healthcare, business to ambulatory areas, easy to report on and show. And the list goes on. Licensed beds, I mentioned. So from licensed bed counts, had an interesting discussion the other day about this is like maybe the capacity of beds, but we understand that beds move around and they can be treated as assets, and that's fine too. So we can report on the capacity from bed count perspective, but also move around and treat those beds as assets. I'll move on actually to maybe another spot and really talk about here zones of care. So whether they come across in the floor plan, so seeing here the ability to adjust your layers to what you see, and here's showing those zones and the labels, and also the ability to match the rooms on the floor to those zones by highlighting those gets into the ability to see and report on your zones of care. Moving on, we'll talk a little bit about the maintenance side and how the facilities console brings that information to this picture to give you that holistic view again. So we can actually, I believe the video will get there. Going to the maintenance tab here, again, seeing a lot of the different attributes and different information on the left-hand side. I can now see what maintenance items and how many in each category, in each status category are there on this floor. The details of those maintenance requests down below, and highlighted on the floor plan, showing the visual context of where that maintenance is, something that we're bringing together in this picture. And when you adjust, and here's the room labels, and when you adjust what you show on the left-hand side, it'll change, highlights. It'll hone in on those on the right-hand side. So if you want to just see those rooms that have maintenance that's on hold, you can hone in on those and then pick that room and see more details. And if you're familiar with the space console, we kind of expanded that in the facility console picture to see the maintenance work there. Again, other space-related attributes such as pressure and compliance deficiencies as well. So many ways of drilling in and seeing room-specific information in one place. So hopefully that gives you an overview of what we're doing and why we're doing it, and giving you more context of the specifics of the facility console and the package. What's next? Well, we're still working on it and refining the development and testing it. We do hope to aim for delivery in June, so it's coming right up. So we're really excited about it. And we won't stop there, of course. There's going to be constant, we'll look to you for feedback, and we'll roll that feedback into future releases. So we already are discussing this and have a nice list of things that we're working on for next, such as additional life and safety floor plan highlights, a portfolio performance overview, more in holistic asset management, bringing that into the picture. And really providing templates to get at least the data development going. When it gets to regulatory compliance, we recognize that gets into what the maintenance personnel need to see and need to fill out in terms of their surveys and checklists, and we want to make that easier to do by providing those templates up front. So those are just a few areas that we're considering for the future. So that wraps up as I mentioned, it'll be about half hour in the presentation. That wraps up the presentation, and now we're happy to take your questions.
Thank you so much, Fred. We do have a few questions that have come through. The first question is the packaging combined in one new module, or do all underlying modules need to be purchased?
Good question. We are packaging it as one package, so it'll include those modules. It'll include those modules together, and it'll also include that additional piece that's healthcare facility specific in that homepage and the facility console that brings all of that together. So we are going to offer that and price it as one package, so you don't have to pick and choose the modules yourself. And of course, if an existing customer, we'll take that in consideration if you already have the modules purchased. But we're offering it as one package.
Great, thank you. Another question: if you already have the modules, are you able to add the facility console?
Right. Yeah. Hopefully I answered that, and we can discuss how that happens. But yeah, we'll certainly make that something we can make available on top of any existing conditions.
Okay, great. If I'm using 24.1, can I take advantage of these features?
Good question. I believe that a lot of these would require, an upgrade. As we mentioned, we're building this on top of 25.4. So the healthcare specific features that we're building would be compatible with that in later versions.
Great, thank you. And then next question, are there any plans to preload compliance standards like Joint Commission or EU accreditation directly into Archibus compliance?
Yeah, good question. I think that's where I was going with the ability to. What we're looking at next is providing those templates out of the box.
Perfect.
And with that, I mean, I'll invite, Octavian, if you're on, if you want to, if there's anything else you want to add, feel free to add or correct me when it comes to the specifics of the offering. But yeah, I mentioned that what's next is those templates.
Right, and right now we do have compliance and deficiencies part in the Facilities Council, and if you want to take advantage of that, it will require the compliance application. But I think to complete what you said before, the minimum set of applications would be, I think, the space, the maintenance, and of course the healthcare package.
Great, thank you. All right, I think that is all we have in the questions in chat. So thank you again, everyone, for joining us today, and thank you to Fred and Octavian for sharing this wonderful new package with everyone.
Yeah, thank you. Thanks for your attention.
Thank you.
All right, everyone, have a great day and stay safe.
Bye-bye.